Good afternoon, everyone. It's 2 o'clock. Thanks for joining us. Time to begin today's briefing. Our featured speakers are Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner at the City of Milwaukee Health Department, Ann Christensen, Health Officer and Director of the North Shore Health Department, and Brown Deer Village President Wanda Montgomery. Mayor Barrett, you're starting us off today.
Well, thank you very much, Sydney. And earlier today, I had the opportunity to be at Midtown, one of our 14 early vote locations, because beginning today through November 1st, which is the Sunday before the election, in-person voting will be available to Milwaukee residents for the 2020 general election. I'm proud to say that we've expanded our locations from just 3 sites that we had in 2016 to 14 sites this year. In addition, we've provided evening and weekend hours despite the pandemic to ensure fair voting for all of us. And this is very, very related to the pandemic, because we know that people are concerned, as am I, about too many people gathering in one spot at one time. And by having the combination of early voting through the mail, early voting through our 15 secure voting sites where people can drop off their ballots, and with these 14 early vote locations, we feel that a majority of the voters will actually have cast their votes prior to November 3rd. But in order to make sure that we are giving people as many safe options as possible, on November 3rd, of course, we'll have over 173 at last count voting locations that will be available. But the voting centers will be taking all the necessary COVID-19 precautions to keep voters and workers safe. As I've said repeatedly, this is now a marriage between our health department and our election commission. We want to make sure that individuals are safe while they're voting. We also want to make sure that we have an election that is 100% secure and 100% filled with integrity. And so safety, integrity, and ensuring that votes are counted are what are really driving us. Mask compliance, and I'm proud to say, when I was at Midtown earlier today and the line was hundreds of yards long, every single person had a mask. Every single person had a mask, and I'm proud to see that. I was telling people how happy I was seeing that, and in addition to that, there will be frequent disinfecting of surfaces, and physical distancing measures will be used throughout the remaining 12 days before that. I did think that people were standing at some points a little too close to each other, but there was pretty good physical distancing. But we're going to be working with our Elections Commission, our Health Department, our Department of Public Works to see how we can ensure that there's even better physical distancing that takes place, because we want to make sure that people put their health first. Remember, when you go to vote, that you need 2 things. You need to bring a mask and you need to bring a photo ID when you vote. And if you aren't comfortable voting in person, again, remember that you can still request an absentee ballot by mail. So if you wanted to, you can go to milwaukee.gov/election to view the full list of in-person absentee voting locations and hours. In addition, the other big news is yesterday was the first day that Miller Park was open for testing. As we've talked about repeatedly on these conference calls, the UMOS location and the Obama Custer location are no longer operating. And I know there were some people who came to the UMOS location yesterday. They were directed to Miller Park. Miller Park is now our community location for testing. And this weekend, our National Guard testing locations at Custer and UMOS concluded their testing. And that's why yesterday, the Miller Park community testing location was open to the public. Testing is available there Monday through Friday from 11 a.m. to 6 p.m. This is being staffed primarily by City of Milwaukee employees, unlike the earlier ones that were staffed primarily by National Guard employees. And so we are still working to see what we can do, because people are working long hours, how we can make adjustments for the weekend. But as of right now, the testing is available here Monday through Friday, 11 a.m. to 6 p.m. You can drive, you can walk up, or you can take the Miller Park shuttle. I was there Sunday afternoon looking at the tent. And what's important about the tent is, as the weather gets colder, there is heating capacity there, heating capabilities. It's not going to be toasty like the inside of your home, but it's going to allow the work to continue through the colder weather, something that we really couldn't do at either the UMO site or at the Custer site. So there will be 5 lanes when I was there on Sunday. I know yesterday it was very, very busy, and that's good. We want people to take advantage of this. You can also walk up, or you can take the Miller Park shuttle. The shuttle picks up people along a route downtown, bringing them to the test site. Right now, there are 2 shuttles. They're Lamers buses that will be running continuously while the testing site is open. Masks are also required on the shuttle, and aboard the shuttle, strict social distancing is enforced. Now, this is not a Milwaukee County transit system route, but the Miller Park shuttle follows the old Brewers line that Milwaukee County Transit formerly ran. Signs are up at stops along the route for people who want to, again, take the bus to the site. And the shuttle route is funded with federal CARES Act money. So we're thankful for that federal CARES Act money. The health department is looking for an additional shuttle route. That route has not yet been determined, but services could begin as soon as next week. A little bit of a COVID-19 update. Last week, unfortunately, our key indicators reflected a troubling trend. Our cases are beginning to move upward. I won't say tick upward, they're moving upward. We have now received 2 red indicators, which is unfortunately a first for our city. Both cases and testing took steps backwards. We now have an average positivity rate of 10.2%, which again is statistically significantly higher than we've seen over the last month or month and a half. I want to take a minute here because I want to show appreciation for all the great public health professionals that we have, not just for the city, but throughout the county, our partnership with the National Guard and the state. I always go back to March 13th. It was Friday the 13th when we had our first case, and it was really about a month before that where we could see the storm clouds brewing and that this was heading our way, when our health department workers really went into overdrive. They've been working tirelessly to protect and serve the residents of our cities since this pandemic began back in March. And actually, as I said, we could see this happening back in February. So it's really been, for 8 months, our public health professionals have stepped up in a way that I have never seen before. We've had many, many calls with them. We've had many, many Zoom meetings with them. So I want to thank those who work for the city. I want to thank those who work for our hospital systems, to our nurses and our doctors and custodial staff and EMT workers and therapists, everybody who's involved in this, because this is scary stuff. And people are really putting their lives on the line, particularly those people who are the frontline workers who are interacting with individuals who have tested positive. So they're diving headfirst. The workers are diving headfirst into this pandemic to help save lives. So we cannot forget the sacrifices they are making. Even as the pandemic fatigue sets in, and we're all so tired of this, we can't turn a blind eye to the growing number of cases and the sustained commitment to our health professionals who are continuing the fight. So we know we're not out of this yet, but I think we have to be thankful and acknowledge all those individuals who have worked so hard to protect us. And with that, I'll turn it back over to you, Sydney.
Thank you, Mayor Barrett. Up next, we have Dr. Ben Weston.
Thanks, Cindy. Good afternoon. First, to our numbers, we've had 35,902 confirmed cases of COVID-19 in our community and 454 individuals who died. So Wisconsin remains among the worst performing states in the country currently with regard to COVID. We have the 4th highest daily new cases per population among states. Meanwhile, hospitalizations in Wisconsin continue to skyrocket, and we're seeing more deaths now than at any point since the pandemic began. Unfortunately, Milwaukee County is not insulated against these statewide trends. We too here are seeing increases in our percent positive rates, as the mayor mentioned, now consistently above 10%, as well as rises in our hospitalizations with really no end in sight at this point. With all these trends and nearly every state in the country trending in the wrong direction, the fall and winter surges that we feared seem to be upon us. And with those surges, we must once again remember the basic principles of staying safe and preventing transmission. As many orders and policies are put in place, it's individual decisions that make a difference in our numbers. And it's important to think of the protective measures as having several layers. So wearing a mask is one layer, keeping distance from others is a second layer, being outdoors is another layer, and shortening the time that you're around others is yet an additional layer. And each of these layers is key, and they add upon one another to increase our safety. Using one layer in isolation becomes far less effective. So wearing masks is important, but if you do it while gathering indoors for long periods, it's not a safe situation. Likewise, being outdoors is helpful, but doing so while standing close to others without masks, again, is far less safe. So as cumbersome as it may be, we must frame every group activity as needing to combine these layers of safety. Wearing a mask and keeping distance and being outdoors helps to maximize our safety. And this is challenging during these colder days and the colder months ahead, but it's what we all must do to ensure that we stay safe, that our families stay safe, and really that our community stays safe. And hand in hand with that vigilance is getting tested when needed. As the mayor mentioned, we now have Miller Park, that testing site open, in addition to the Northwest and South Side Milwaukee Health Department sites, and 16 additional health system testing sites. Anyone with symptoms, anyone with close contact to someone who's tested positive, or if you've been referred by a healthcare or public health practitioner, please get tested. And importantly, please isolate away from others after you receive your test until you get your results back. The easiest way to find a testing site now, I think, is to go to testupmke.com. So thank you all, stay safe, and I'll pass it along to Interim Commissioner Jackson.
Thank you, Dr. Weston. So I'm first going to take a little bit of time to talk about masks, and then I'm going to talk a little bit about our City of Milwaukee gating criteria. So first, I want to just remind you all of the city ordinance for masks that took place and was in effect on July 16th. And with that ordinance, it was a requirement that all public buildings and individuals who are within 6 feet of other individuals are required to wear a mask. With that order also came a directive in regards to the City of Milwaukee Health Department being able to provide masks to the City of Milwaukee residents. And it was a charge that we were happy to take as we understand the significance and the impact of masks. And so I just wanted to share with you all that the City of Milwaukee since July has been able to provide over 120,000 adult masks for distribution. In addition to that, we've provided over 18,000 children masks and then over 2,000 masks for ADA, or what we call SMILE masks. Those masks are provided and distributed throughout the community at different locations. And you can go to the Milwaukee Health Department website, masks, to find locations where the masks are available. I also want to point out, I don't know how clear this can be seen or not, but this is the Milwaukee Health Department logo. And each mask that we have procured through businesses that are all locally owned, so we're excited about that. But each mask has the Milwaukee Health Department logo on that. And we felt that was important so that individuals in the community know that these are free of charge, and you can get them again at the noted sites on the website. That includes our 2 City of Milwaukee Health Department centers, or clinics, excuse me, Southside and Northwest Health Clinic. So we just ask, and we've heard this time and time again, I think as healthcare professionals, it is just burned into our brain. And we want to do our best, to be very honest, to burn it into your brain, because we know that it works. We know that masks work. It's one of the steps, one of the layers, as Dr. Weston had discussed, that we know is tried and true. So the more we can get the masks out, the more that you wear them, the safer as a community we will be. And the sooner we can go back to moving in a direction of less cases, less sickness, and less deaths. So now I'm going to move on to our gating criteria for the City of Milwaukee. So As Dr. Weston had shared regarding trends, we in the city of Milwaukee are noticing the exact same negative trends that have been noted across the county. Specifically, I want to just give some reminders around what our gating criteria are. And really what our gating criteria does for us is it measures for health departments and health professionals. It measures for us how well we're doing in regards to slowing the spread or keeping it under control to the best of our ability, but it also gives us an idea of how prepared we are when we get upticks or increases in cases. So our first gating criteria is care, which is really the ability for hospitals and hospital ICUs to have the capacity to care for individuals that need their need critical care services. And for the city of Milwaukee, we continue to be, for our gating criteria color, we continue to be in green. We are really lucky and fortunate that we have some large healthcare systems that are in the city and as well as border our city that provide us with good support there. Second is our ability to have PPE or personal protective equipment, whether that's N95s, gowns, gloves, that those are available for healthcare professionals to use when they're providing their interventions, whether that be care in a healthcare setting or other settings where you have to be within 6 feet of an individual to provide whatever your intervention is. So for the city of Milwaukee, we are yellow there, which means that we have between 8 and 28 days of supply for again, those healthcare professionals or professionals that need PPE, and that it's required to do the work that they do every day. For contact tracing, which is really something that's to some extent directly in the scope of the City of Milwaukee Health Department and individual health departments. For contact tracing, that's our ability to contact individuals who have come in contact with someone who has tested positive for COVID. It is one of the basic public health measures that we use to try to slow the spread. If you don't know that you've been in contact with someone and you might not be symptomatic yet, that means you have the ability to go and spread that disease. As a public health department, we know that the quicker we can get in contact with you to tell you that you might have been exposed gives an opportunity for you to quarantine sooner or at least monitor your symptoms as well. So for the city of Milwaukee, our contact tracing measure is yellow at this point, which means that we are able to reach individual contacts within 2 days of being assigned those cases. And that would be for 50%, at least 50% of the time. So now I'm going to move to our last two metrics, which unfortunately and quite honestly are super concerning for us as public health officials, is testing and our cases. So for the city of Milwaukee, the ability to test and to also look at our percent positive measures our disease burden within our city. And so for testing, as a city, we are in red. And that means that we have been over 10% positivity rate for at least the last 5 days. In addition to that, we also use testing numbers. So how many tests are we being able to provide to the community within a particular day? And so for our testing, while we have done really good with the support of the National Guard and with just the last week's opening of this health department sites, we continue to do well in regards to the number of tests that we're able to provide. The positivity rate has continued to go above the 10%. When you look at CDC guidance, when you look at other experts in the field, that 10% is really a red flag to say, where are we in our ability to control this pandemic? And where does our crisis standards fall, at what number? And so 10% is one of those numbers where you look up and you say, this is a red flag. It's a red flag for us in a health department, and it should be a red flag for us as a city. And lastly, our total number of cases. So that is a raw base number. So how many cases just do we have in the city of Milwaukee? And we trend that. And we are also red for that particular gating criteria. And we're red because we've had 14 14 days of increases in that flat number. So what that means for us as a leadership team within the Milwaukee Health Department is that we had decided early on that we would, once we reached one red criteria, that is our determination that we need to go back, look at our Moving Milwaukee Forward Safely order, and see if and when anything needed to be adjusted. So as I've just shared, we're at 2 red for the city of Milwaukee. So over the next few days, that is exactly what we're going to do. We're going to go back, look at our order, see what adjustments we can make, if any, and then we'll be sharing that with you as soon as it's complete. Lastly, I just want to share that as we move closer to Halloween, as we move closer to the holidays, we know we hear this anecdotally and we see it in our trends as far as holidays in the past, that a holiday hits and we have a spike or an increase in cases around 1 to 2 weeks after that. And so knowing that we have a number of holidays coming up, I would ask you as a public health official that you continue to be mindful and to make individual safe decisions that include wearing a mask, including watching your distance, so that we can continue to try to keep our control over our cases. And with that, I'm going to turn it over to Ann.
Thanks, Interim Commissioner Jackson. Appreciate the shout out, Mayor Barrett, to public health. This seems to be the focus of today's briefing, and I'm going to go into it a little bit more in terms of what local health departments are experiencing. So I am the director of the North Shore Health Department, which serves the 7 communities in the northern part of Milwaukee County, from Shorewood to Brown Deer. And myself and my colleagues are really at the front lines of responding to these record-breaking numbers that we're seeing over the last few weeks. And I wanted to talk specifically about the tools that we have in our local health departments to respond to COVID, and specifically that contact tracing piece. As local health departments become more and more stretched in terms of our human resources with these surges in cases, it's really important to understand why this is such a valuable tool for preventing and mitigating the spread of COVID. So essentially, as you've heard over the last 8 months, local health departments are charged by state statute with notifying cases of people who have COVID, so positive cases. And we conduct a disease investigation amongst those positive cases where we learn about their signs and symptoms. We review where they might have acquired COVID so we can understand backwards where they might have got it. And so we can determine if there are certain outbreaks that we are not aware of that we can prevent further spread from happening. We provide guidance on isolation and the duration of that isolation period for that person who has the disease. And then importantly, we identify who might have been in close contact with that person so that we can assist that person or do the notification of those close contacts. And that identifying those contacts and having people be in quarantine after exposure really is a critical tool in preventing further spread of the disease amongst the population. What I wanted to talk about is just the value of disease investigation in terms of its impact on hospitalizations and COVID-related fatalities or deaths from COVID. One of the things that our case managers do in terms of that process is, again, they are in touch with people who have COVID on a day-to-day basis, either through a phone call, a text message, or even an electronic reporting system where people report their signs and symptoms to those case managers through the duration of their isolation period. And what that does for the case managers is really identify the day-to-day trends and signs and symptoms and allow the case managers to work with people if they notice things that have changed in their reporting of symptoms. Obviously, we hope for a change in terms of improvement of symptoms. A fever goes away, a cough is no longer being reported. But also importantly, we and those case managers are able to identify when things are turning for the worse. And that can look like shortness of breath that wasn't there before, or a fever that's ticked up a bit. And that's an important early identification piece in helping that person determine, is this a sign and symptom that's concerning? Is it normal in the course of a COVID illness, or is it something where people should seek additional medical care? And we've really been at the front lines of helping people to navigate those signs and symptoms, and recommending that they call their provider to get in to seek medical care, or in some cases call 911 and get emergency care if something is really not looking good for that person. So local health departments really work in partnership with people with COVID to help them through the duration of their illness. And it's a very valuable connection that we have to people. But it's also a really important tool for helping, again, both prevent and disease in the population and the community, but also to help people get back on track and get better quickly before the disease progresses into something that's going to be more concerning and needing medical care. So that's something that I wanted to share with you in terms of why local health departments really are an important player in this, in preventing COVID and minimizing the spread. As we're called upon to manage more cases of COVID, note that our resources really are being stretched in terms of the staff as well as our financial resources. And as we look and have to shift to crisis standards and prioritizing who we have the ability to contact, it really is impacting how how we're going to be able to get through this. And I just want to make a note in terms of 2021 and the need for looking at continued funding for local health departments to be able to manage this response. With our federal CARES dollars that have come to local and state governments, we know that many of those deadlines are set for December 31st. And as we look to January 1st, the resources that we're going to need to continue to respond to COVID-19 are going to be there as they were in 2020. So we look to our leadership to help us to be able to have the resources to respond to COVID-19 now and into the future. So again, we're recognizing that we are all in this together, and we really need to pull together with our own individual decisions and making good choices about what we're doing and making sure that we've got those measures in place, wearing the mask, keeping socially distant, so that we can all get through this fall and winter and get on the other side of this surge. So thank you very much. And we'll turn it over to President Montgomery.
Good afternoon, everyone. And I want to take a moment to thank you and all of our public health officials for the tremendous amount of work that they have done throughout this pandemic. I'd like to take a point of personal privilege to acknowledge Ann personally because I get to her and receive ongoing information that is helpful for me as the president of the village, and information that I can share with our residents here in Brown Deer. All of our public health departments and their teams have been working tirelessly to keep our community safe and to stop the spread of COVID-19. From working with our schools, churches, community organizations, and businesses on guidance, to following up with individuals who have tested positive for COVID-19 or who may have been exposed, they have carried a tremendous load over these past few months. And I'm sure as we see the numbers rising, they will continue to do the work that they have been doing. We want to thank them for their tireless efforts. Our numbers in Milwaukee were steady over the last month, but as we have heard earlier, they're starting to rise up. And we know we can do this. We know that if we just follow the things that we've had in place, we can be successful and keep the level, keep it lined out so that it doesn't keep going up. Milwaukee can do this. What we're seeing statewide is that COVID-19 continues to spread, and we're not out of the woods. There's still work to be done. but the work gets done by each one of us. The health department provides us with the information. They're there to do the contact tracing, answer our questions, but it's important for us to do the things that we need to do. If you are told to quarantine or isolate, please, please, please follow the guidelines and instructions you've been given. If you delay 1 day, 2 days, it just gives opportunity for things to continue to spread. And so it's important that you respond and respond immediately to the calls and certainly to the guidelines that they provided. We all have a role to play to keep our community safe. We need to wear our mask in public. And you know, I've had the opportunity over the last few days to visit my mother, and I wear a mask when I'm in her complex, in her apartment, because I'm going out. She's not. I want to make sure that I'm providing an environment for her. So wear your mask in public, but even if you think you're going to be around someone who's not been out, wear it there too. Wash your hands and maintain physical distance. As I think about the resources that we need to support our healthcare professionals, you know, we're in our budget planning now, and it's going to be important that we have the resources to serve our community. But we also know that if we do our part, we won't need as many resources in the future. We can do this. We did it before, and we can do it again. So Milwaukee County, we need each and every one of you to do your part so that we can stop and reduce COVID-19 in our community. Thank you.
Thank you, President Montgomery. Our first question came from Patrick Palantonio. It was answered in chat. It was for Commissioner Jackson about elaborating on the moving Milwaukee forward order and potential changes. There are no specifics yet, but stay tuned for more information later this week. Our next question comes from Sharon Bajenda at CBS 58. Mayor Barrett and Commissioner Jackson, can we get an update on bars, any sort of enforcement that happened over the weekend and what you've seen? And then the follow-up question was for Dr. Weston about the increases in state cases. So we'll start with Mayor Barrett and Commissioner Jackson on the bar updates.
Sure. I can start in regards to the bars and restaurants. So right now, we continue to follow our current process in regards to individual bars and restaurants that violate their order or violate the safety plan that they submitted to us, and that includes an initial communication followed by a warning letter and then a citation. So that's where we are. I can tell you that we continue to receive individual complaints through our Ask MHD COVID-19 website, as well as pictures and videos through our Facebook page of different establishments that are continuing to allow large gatherings, as well as without being masked and without following the safe business practices. So as we get those, we are following that process. Again, we are in the process of looking at our current order to see what, if any, options we have. And at this point, we're looking at the entire order. So all of our sectors, all of the individual groups and establishments that are impacted there to see how, again, we can, whatever we can do to slow that spread.
Thank you, Commissioner
And
Jackson.
I'll turn it to Dr. Weston.
Yeah, I think the question is referring to the increased number of cases that Wisconsin is reporting today. So 4,591 new confirmed cases today, and whether that is, correct me if I'm wrong, but I think the question is whether that is related to a backlog over the weekend because there were some updates with the WED system, or whether it's a true increase that we're seeing. I'd have to defer to the state, but my guess is it's a true increase because they're also showing cases for the 18th and the 19th as well. And looking at the county, we're certainly seeing increased cases. So I would guess the number is real and the state is indeed seeing increased confirmed cases as well.
Our next question comes from Patrick Palantonio at WISN 12. Commissioner Jackson, do you anticipate an update to the Moving Milwaukee Forward order by the end of the week?
I'm hopeful to get it out by the end of the week, but we'll do our best. We're working as fast as we can.
Thank you. Our next question comes from Caroline Reinwald at WISN 12. Dr. Weston, this one is related to testing. We have reported very long lines at the new public testing sites. Viewers have complained about waiting in line for hours to get tested. Has there been a sudden surge in people getting tested, or is it taking longer to get the same number of people tested? Any thoughts as to why?
Commissioner Jackson, did you want to field that, or do you want me to answer that one?
Yep,
Sure.
I can take it. So this is the first week. As a matter of fact, this is day 2 for the Miller Park site to go up. So what I understand from looking at the testing number yesterday, which I think was around 1,600, we feel like that's appropriate. Like that is the capacity that we're able to handle at that site. It was truly logistics of first day, and it might be first week maybe, or first few days, but it was a matter of just logistics and getting some lanes rerouted, which I understand we did do late yesterday. So that's pretty much where we are. It's a new site. It's a new team that's all working together for the first time. So it's just kind of getting the kinks and the bugs out so that we can run it as efficiently as possible.
And I'd like to concur with the commissioner, because as I looked at the numbers for yesterday, the actual numbers were 1,658 at Miller Park. And to put that in context, on Friday, we had about 1,068 at UMOS and 501 at Custer. So we had a total at those two sites of 1,569. So those two sites on Friday tested fewer people than were tested at Miller Park on its first day. So it was the first day. I was there Sunday afternoon as Dr. Tamara was setting it up, and they were setting up the lanes. And so again, I think, well, I ask people to be patient as we work out the kinks, but putting 1,658 people through that was pretty amazing for the first day. And I'd also add, that's not the only site where we're testing. And I want to remind people, we also have our site at the Northwest Health Center, where yesterday we tested 305 people, as well as our Southside Health Center, where we tested 274. So during the course of the day, we tested 2,237 people. That's a lot of people to be tested. And I don't think anybody expects that they're going to get in and out in 5 minutes. But we appreciate the patience. We want to do better. We want to have as short a wait as we can. But there are a lot of people being tested, and we want to test a lot of people. We think it's important, particularly if you're showing symptoms or if you've been exposed to someone who has COVID-19. Please make sure that you take advantage of this and go to either your own healthcare provider or come to one of our community's testing locations.
Thank you, Mayor Barrett. Our next question is for Mayor Barrett and Commissioner Jackson, also from Patrick Palantonio at Channel 12. Following the recent court decision regarding the statewide 25% capacity order, are bars and restaurants in Milwaukee following the state order or the statewide capacity order or the Milwaukee reopening plan? Who are the city workers staffing the Miller Park facility, and which departments are they from?
Well, we continue to have the Milwaukee order in effect. It's our view that this is more restrictive than the state's, and we look at it really from a quality rather than a quantitative approach. And that's not in any way to be negative as to what the governor has done. I think the governor's done a remarkable job in the face of incredibly strong headwinds, because the legislature has refused to engage in this whatsoever. So I thank Governor Evers for the leadership he's shown. We continue to have the order that we have had in effect for some time, unimpeded by any court action that took place last week and then earlier this week. But we continue to look at the numbers. And so when Commissioner Jackson talks about how we're looking at our criteria as we're looking at how things are here in the city of Milwaukee, I am concerned. I know she's concerned. We don't want to see these numbers continue to climb. And we're going to do everything we can to make sure that we're operating in a safe fashion. So again, we are going to continue at this time to enforce our order. We've had conversations with the governor's office about that. I think they prefer us to follow their order, but there's an understanding that we are very engaged in this in Milwaukee. Some locations, some communities simply have not been able to devote the resources we have. We have devoted a tremendous amount of resources in our health department to develop this and have worked very closely with bar owners and restaurant owners. As I've said previously, I am concerned about some of what I've seen in bars, and we're continuing to monitor that very closely.
And I would just add that if for restaurants that had not submitted, or restaurants and bars that had not submitted their safety plans to us by the deadline, they do have to operate under the governor's order of 25%.
And the second part of the question is, who are the city workers staffing the Miller Park facility? They're hired through the health department. Some of them are current health employees, and we're continuing to recruit. Commissioner, you want to say anything about that?
Yeah, so it's really a combination, which is speaks to, I think, some of the partnerships that we've been able to forge with the county, with Dr. Weston and his core team, as well as through the help of Employ Milwaukee to get staff. So, and right now it's also still staffed, supported by the National Guard. So there's Milwaukee Health Department staff. There are some core Milwaukee County staff, as well as National Guard sites. So obviously, as we continue to, as the National Guard continues to phase out, the Milwaukee Health Department staff will increase in those ways. And we are in process of continuing to recruit so that we can have all three of those sites staffed and ready to go.
We have another question from Caroline Reinwald at WISN 12. Mayor Barrett, can you elaborate on why the city of Milwaukee's order is not being impeded by the governor's order? Legally, how is the city allowed to continue with this order?
The governor's order states that if a community has an order that's more restrictive than the state order, they may continue to operate. And based on the analysis of our health department, as well as our analysis by the city attorney's office, we concluded that our order is more restrictive. That's the authority we're operating under.
It looks like that was the final question in chat. Are there any other questions for our panelists? All right. Thanks everyone for joining us. We will be back here again on Thursday.
Thank you all.
Thank you.